Hey guys, welcome back to Nursify, the place where nursing students come to excel and pass exams with confidence. I'm Courtney James and I am a pediatric nurse practitioner. And in today's video, we will be breaking down asthma in a clear, simple, exam ready way. If asthma has ever confused you in class or during exams, you're in the right place. So let's jump in. We will be covering how asthma affects the body, what causes and triggers it, how it's diagnosed and treated, and how to live with it. Asthma is a very common chronic condition, especially in children, and so understanding it helps patients and families manage symptoms and live healthy, active lives. By the end of this presentation, you should be able to explain what asthma is, recognize the symptoms, understand the triggers, and identify basic treatment approaches. So, of course, we'll be lining out what we'll be studying today. And so, again, we'll be talking about what is asthma in the pathophysiology, the symptoms, the causes, the triggers, diagnosis, treatment, and living with it. So, what exactly is asthma? Asthma is a chronic lung disease that is obstructive in nature, meaning it blocks or narrows the airways. It can affect both adults and children, but it is especially common in childhood. Asthma happens when the airways become very inflamed and narrowed, making it hard for you to get the air in and out. And so that ends up leading to a lot of the symptoms that we see with asthma, which we'll talk about shortly. Currently, there's not a cure for asthma, but it can become well controlled with the right treatment plan, which is why it's important to know what those treatment measures are. So let's look at the pathophysiology of asthma. Asthma consists of three main processes, which includes inflammation, bronchoconstriction, and mucus production. The inflammation is when the airway becomes very swollen and irritated. Bronchoconstriction is when the muscles in the airway become very tight, making it very difficult to get air in and out because the passageway is so narrow. And then third, you get a lot of thick mucus that produces in those airways, which further contributes to it being a narrow passageway, making it difficult to get air in and out. Together, these three changes make it very difficult for people with asthma, leading to a lot of symptoms that they encounter. I'd love to show you visually what this looks like, okay? So if you look right here, this is a normal airway. You'll see that it's very patent. It has a good opening. There is no blockage. As you come over, you will see that this airway is the complete opposite. It is very inflamed. It is very tight. The muscle around it is constricting. And so this is what an airway looks like when you have asthma. Over here is another depiction of it on the right-hand side of the screen. Again, you will see that swelling, mucus, and the muscle tightening or the constriction is what makes up asthma and leads to those symptoms that we see. So let's talk about what exactly those symptoms are. So you may have wheezing, you may have shortness of breath, excessive coughing, which some people don't realize that coughing can be a sign of asthma as well, and chest tightness. Now, if you have severe asthma symptoms, such as with an asthma attack, you might see more extreme symptoms, which include severe wheezing that may be audible to the ear even outside of auscultation. Or maybe you'll see labored breathing, especially in young children where they have retractions at their suprasternal area or their subcostal area. You might have fast breathing, also known as tachypnea or elevated heart rate. And for very extreme cases, you may see lethargy, where it's very difficult to get the child or adult to respond, or even cyanosis. Recognizing these symptoms right away is very important so that you can start treatment right away and hopefully prevent the escalation of these severe symptoms or an asthma attack. Here you will get an example of what wheezing sounds like, followed by what coughing may sound like in someone with asthma. So, of course, those did not sound great at all. So, again, we really want to make sure that we help individuals with asthma so that they don't have to suffer through those symptoms. So now let's look at the causes of asthma. So they have not been able to pinpoint an exact cause for asthma. However, there are several things that can increase an individual's risk of development. So some of these may be genetics, meaning if you have a mother or a father with asthma, their child is at higher risk of developing asthma. Pollution, so if you live in a city that's highly polluted, that can lend to asthma development. Having an allergy related condition, such as allergies to pet dander or food allergy, that can increase your risk of asthma development. Or even childhood exposure to tobacco smoke can lead to asthma as well. And so, of course, if you have several of these things that you've been exposed to, your risk for asthma may be much higher even than someone with just one of those risk factors. These risk factors can make your airway more sensitive and prone to inflammation, which, of course, again, is one of the characteristics of asthma. So now let's look at some of the triggers. Generally, there are certain things that can trigger your asthma symptoms, and these can vary from person to person. So some of those might be viral illness. We see this a lot in young children. They may catch RSV or the flu or some other viral illness, even a common cold that can trigger the cough and the wheezing that they experience with their asthma. Or maybe weather change. And this can be any weather. This can be hot weather, cold weather, and sometimes it's the variability in weather going from one extreme to the next that can trigger asthma symptoms. Maybe allergies. Again, if they have a pet allergy or an allergy to an outdoor allergen such as trees or pollen, that can spark asthma symptoms. And exposure to tobacco smoke as well can be another trigger. Um, Something else I like to mention as well is even smoke from a bonfire. Smoke that you may not even think of that's not related to tobacco can also create asthma symptoms in certain individuals. And so it's important to identify what the person's triggers are to help them thus avoid them if possible and therefore decrease their risk of asthma symptoms and severe asthma exacerbations. So now let's talk about how do you come to an asthma diagnosis. An asthma diagnosis is a combination, you use a combination of things to come to this diagnosis, which includes a thorough history, physical exam, and sometimes respiratory test as well. The history is important because, again, we want to know, are there risk factors that's helping increase your risk of development of asthma? For example, we want to know your family history. We want to know your personal medical history. Do you have a history of allergies? Do you have a history of atopy, such as eczema? We want to know about your environmental exposures. You know, are you commonly exposed to your allergens, or are you commonly exposed to polluted areas? These are important things to know, and this will help you come to your diagnosis. In combination with that, you may do certain tests such as spirometry. For example, pulmonary function tests can be very helpful at looking at the airways and determining if there's any inflammation present or obstruction present that responds to albuterol. You can do certain tests like a pheno test or a methylcholine challenge. Some of these tests may involve inducing bronchospasm, such as the methylcholine challenge, and then determining if that patient is responsive to albuterol. And lastly, the physical exam can be a key piece of diagnosis as well. When you're listening to lung sounds on exam, you want to make sure that you don't identify any wheezing, whether inspiratory or expiratory. And you also just want to make sure that they have clear auscultation, no diminished lung sounds. These are different physical exam findings that if you do hear them, that could lead to a diagnosis of asthma. So then how do we treat asthma? So it's important to know that the treatment for asthma really focuses on keeping the inflammation low and the airways open. And so the mainstay therapy for asthma, especially persistent asthma, are inhaled steroids. Inhaled steroids help treat inflammation. And so their job is to lower the inflammation in the lungs and therefore reduce the swelling that people with asthma are experiencing. These can come in many different options, many different forms. There's mometasone, fluticasone. There's lots of different options for inhaled steroid therapy, and these are called your preventative or your controller medications because they help prevent severe asthma exacerbations and help prevent frequent symptoms. You also have bronchodilators, and these are medications such as albuterol. The purpose of the bronchodilator is to help the constriction portion of asthma. So they dilate your airways to help keep those airways more open. These are best used in acute episodes when you are actively coughing, wheezing, or having trouble breathing. They're short term or temporary lasting in the body, and so they really serve better in those acute episodes, while the inhaled steroid really serves best for preventative long term management. Some people have severe asthma that is not treated well enough with inhaled steroid alone, and so they have to be on a combination inhaler. Combination inhalers have both inhaled steroid in them and long acting albuterol in them, and together those two medications work together to lower the inflammation and help dilate your airways. You might have additional medications that you use in addition to your inhaled steroids, such as LTRAs. An example of an LTRA is montelukast. Montelukast is a tablet that can be taken and it helps improve both asthma symptoms and allergy symptoms. For individuals with severe asthma, they may require oral steroids. Oral steroids are much more potent and they work much more quickly to help treat acute severe asthma symptoms. However, if you require enough of them, it can lead to side effects that we don't love. And so our goal is to avoid the oral steroids by using the preventative management, the inhaled steroid, which is a safer approach to preventative therapy for asthma. Some people might require biologics. Biologics are injections that are given that treat the various inflammatory pathways in asthma, therefore helping reduce inflammation. So those can be helpful as well. And then you have complementary measures or therapies that you can use, such as trigger avoidance, breathing exercises, and exercise. Those can help strengthen the lungs and avoid the things that set off your asthma symptoms to begin with. It's really important to use all of these things in conjunction with each other because it gives you a well rounded approach to the treatment of asthma. Living with asthma requires maintaining a healthy lifestyle and following a treatment plan consistently. Patients should take their medications as prescribed, attend regular follow up appointments, and avoid their known triggers. Additionally, keeping a lifestyle that is healthy, such as exercising and having a good diet, can also help with your asthma management. It's important to know that you can live a full life with asthma. And our goal is always to keep you active, to keep you able to do the things that you enjoy doing. And so, again, these are the things that can help you do that by adhering to your regimen, following up with your provider, avoiding those triggers, and being as healthy as you can. So, before you go, remember your exams are based on the material your school and instructors provide. So, that's exactly what you need to master. Nursify AI helps you learn, simplify, and retain your school material faster so you can study smarter and not longer. Click the link below or in the top right corner of your screen to learn more about Nursify. Thanks for watching. I hope you guys learned a lot about asthma. Good luck on your exams, and I'll see you in the next video. Bye.